All right, we're on D right now. D, 176 to 200. True or false? The large accumulation of liquids found along with excess fat in the tissues may be reduced by heat treatments. False. You can't reduce fat by heat or massage. You just can't. What materials besides liquid is removed from the body through the pores during treatment in a steam or heat treatment of cabinet? This is subcutaneous oil. Subcutaneous oil. Name two advantages of needle spray following a heat treatment. It takes off the oily, fatty substances and keep the client warm. In what form are excess fat found in the body? Tiny fat globules, liquid. What effects does the Swedish massage have on a muscle? The effects that a Swedish massage have on a muscle: it stimulates the muscle and activates the flow of blood. In performing the circular manipulation and passage of the right gluteal area, what is done to help activate the three crossing layers of thick muscles? The skin rather than the fingers are moved, and the left hand is placed on top of the right for additional pressure. It stimulates the muscle and activates the flow of blood. How is twisting manipulation applied to muscles? By placing both hands next to each other, then pushing the tissue forward with the palm of the hand as fingers of the other hand pull the tissues back. With what weight should the cupping manipulation be given in the region of the scapula? Light. Just weight of relaxed hand. True or false? Proper coordination in performing combined cupping and friction requires that the separate movements be first practiced quickly. False. In manipulation of spinal column, why is it necessary that two fingers placed on the spinuous process be in a straight line? This is out of the scope of the practice of the massage therapist. Why should massage therapists not place people on a specific diets? What can be recommended instead? Because they are not doctors, recommend that they go see a physician or food specialist. Why are proteins needed in the diet? Name the classifications of food. Proteins are needed in the diet because they help in rebuilding and repairing muscles, glands, and nerves. The other classifications of foods are carbohydrates, fats, minerals, and vitamins. What is one special function of all vitamins? To assist the body to make use of the food in which they are found. Describe therapeutic massage, a technique manipulation that relieves a specific pathological condition in the body. Describe physiological massage, a technique of manipulation that assists in keeping the body in a healthy condition. What type of massage is usually given in a private practice? Swedish. What determines the type of treatment to be given in a therapeutic massage? The physician recommendation. What is the difference between massage as usually applied in a hospital and a massage institution that functions at the rest of the homes? The former is almost all therapeutic, often under direct medical supervision, while the later is sometimes physiological as well. Define remedial exercise, scientific applications of body movement designed to maintain or restore normal muscles and joint functions. What are the passive movements and how do they differ from active movements? Passive movements are those performed solely by the therapist without assistance or resistance being offered by the client. Active movements are those performed by the client with the assistance of the therapist or without the therapist. In applying remedial exercises, why is it necessary that the massage therapist knows the type of movement each joint is capable of performing in order to avoid straining of a joint? Name the three classifications of joint movements and explanations of the movement. There's three: abduction, adduction, and flexion. So flexion is the closing of the hinge joint, such as lifting of the forearm. Adduction with the like you add something, adduction, ADD, movement toward the body, as bringing the arm back to the side. That's adduction, like you bringing in energy, adduction. Abduction, movement away from the body, such as lifting the arm out from the side of the body. Okay, those are the three. Now we're going to go over a few more. There's extension, retraction, let's go over extension. Extension is to straighten a joint, such as bringing the forearm straight with the arm. So, like extension, that's with the triceps. You straighten a joint, such as bringing the forearm straight with the arm. Now we're going to go over retraction and protraction. Retraction, backward movement, such as pulling back of the shoulders. Retraction. Protraction, forward movement, such as pulling forward the shoulders. Now there's circumduction, supination, and pronation. So circumduction, circular movement, such as when the foot or the hand held straight out performs a circular movement, moving the limb. Okay, hands, your wrist, you kind of moving in a circular motion. Supination is to turn the anterior side upward, such as turning up the palm of a hand. Pronation is the turn of the anterior side downward, such as turning the palm of the hand down. One of the non-possible joint movements the shoulder can perform 7. Name the 2 movements the shoulder cannot perform. The shoulder cannot perform supination and pronation. What are the 4 therapeutic effects of remedial exercises? It assists in maintaining nerve power by stimulation through stretching and shortening of the muscles. It increases supplyness of joints. It improves the lymph circulation and hastens the return of venous blood by muscular compression and joint movement. It also assists in preventing and shortening of muscles and formations of adhesion.